Here I will talk about the anatomy of pharynx part 2. In the last lecture we have seen the mucosal lining of the pharynx, the Wilder ring. Now the one fascia is present. The fascia is known as the pharyngobasilar fascia. The pharyngobasilar fascia is situated just behind the epithelium and the subepithelial lymphoid tissue. So these are the lymphoid tissue. So behind the lymphoid tissue, the lines which lines the muscles of the pharynx anteriorly, because muscles of the pharynx are present behind the lymphoid tissues. Behind the lymphoid tissues there are the muscles of the pharynx, the muscles of the pharynx. So anterior to the muscle of the pharynx and behind the Wilder rings there is a pharyngobasilar fascia. This pharyngobasilar fascia also forms the capsule of the tonsil. Capsule of the tonsil. Now comes to the what are the muscles of the pharynx. So the muscles of pharynx. Pharynx has basically two types of muscle. Inner longitudinal. Inner longitudinal. In the esophagus we found in the GI tract there is outer longitudinal, inner circular. But here inner longitudinal and outer circular muscles. Outer circular muscles. So what are the inner longitudinal muscles? These are three inner longitudinal muscles. One is stylopharyngeus. Stylopharyngeus. So it extends from the styloid process to the pharynx. Second one is salpingopharyngeus. Salpingopharyngeus. So salpingo means eustachian tube, so it extends from the eustachian tube to the pharynx. Another one is palatopharyngeus. Palatopharyngeus. So it extends from the soft palate, sides of the soft palate, lateral side of the soft palate to the pharynx. Palatopharyngeus. So these are the muscles which are attached to the from the styloid process, from the eustachian tube and from the palate to the posterior border, not to the pharynx but to the posterior border of thyroid cartilage. Thyroid cartilage, to the posterior border of the thyroid cartilage. There is an oblique line in the thyroid cartilage, the ala of the thyroid cartilage, so which extends from the superior cornu to the inferior cornu. So from the posterior border of the thyroid cartilage they are attached these muscles, and they elevate and dilate the pharynx during the swallowing. So the function is to elevate and dilate the pharynx while swallowing or deglutition. Now the outer circular muscle. So there are three constrictors muscles which are outer circular: superior constrictor, middle constrictor, and inferior constrictor muscle. So the uppermost part of the pharynx is the superior constrictor. The upper border of the superior constrictor is not attached to the base of the skull. So the base of the skull and the upper border of the superior constrictor there is a gap. This gap is known as the sinus of Morgagni. So the base of the skull, is there, and there is the attachment not to the base of the skull, but here is the superior constrictor muscles are present. Superior constrictor muscles are present. So this one is the pharyngobasilar fascia. Anteriorly we have told that there is a pharyngobasilar fascia. So this gap is covered by a pharyngobasilar fascia. Pharyngobasilar fascia. And this gap is known as sinus of Morgagni. Sinus of Morgagni. So what are the structure which passes through the sinus of Morgagni? There are some structure which passes through the sinus of Morgagni. There are 5 structures which are present in the sinus of Morgagni. What are they? Number 1 is tensor veli palatini muscle. tensor veli palatini, which elevate the palatini, ascending palatine artery, ascending palatine artery, ascending pharyngeal artery, ascending pharyngeal artery, the palatine branch, levator veli palatini, levator veli palatini, and the auditory tube, that is the pharyngeal part of the eustachian tube. Now this is the superior constrictor muscle, and from this there are the middle constrictor muscle. So these are the middle constrictor muscle. So in between the superior constrictor and the middle constrictor there are some structure which is possible. So what are the structure which lies between superior constrictor and the middle constrictor? There are two structures. One is stylopharyngeus muscle, another is glossopharyngeal nerve, the ninth cranial nerve, the glossopharyngeal nerve. Now the superior constrictor and the middle constrictor now comes to the inferior constrictor, so in between the middle constrictor and inferior constrictor there is two structure. This is the inferior constrictor. So there are two structure in which is present between the superior constrictor and middle constrictor and the inferior constrictor. What are they? Internal laryngeal nerve, which is a branch of superior branch of vagus nerve, and which is a branch of superior laryngeal nerve. So vagus nerve gives a branch of superior laryngeal nerve, that gives a branch of internal laryngeal nerve, and second one is superior laryngeal vessels, superior laryngeal nerve and superior laryngeal vessels. Okay, and the structure which is, and from here the esophagus starts. So the structure present in between the inferior constrictor and the esophagus is two things. One is inferior branch of vagus, 10th cranial nerve, and another is inferior laryngeal vessels,